Kenya Institute of Special Education, Kenya Industrial Training Institute in Nakuru, the Kenya Medical Training College, Kenyatta Hospital, Mathari Hospital, Nairobi Hospital, and Pride Inn Hotel.
I do not wish to scare you, but with the figures I have just read to you, there is no gainsaying that this is a very serious threat to our lives and to our nation. This number, I must say, is going to rise, and it is going to rise exponentially.
In a bid to stem the further spread of the pandemic, tuk-tuk operators and their passengers will now be required to wear face masks. The Ministry of Health is also encouraging all public service operators to use the masks, whose local mass production is already underway at various textile outlets in the counties. In addition, up to 6,000 health workers will be recruited in less than a week in order to boost the health sector.
Do not wait to hear of a death near you for you to realize that the disease is not a joke. By the time you are hearing of a death near you, it could well be your own death. And of course, you won't hear.
With up to 22 counties lacking ICU installations, the government intends to convert some of the private and public learning institutions to temporary health facilities in order to build capacity. Seth Olale, NTV, Nairobi.
So let's just talk quickly and get a response from Dr. Robert Madenge, physician and cardiologist. Daktari, you definitely saw the update from CS Mutahi Kagwe and quite some shocking numbers or forecasts there. Is he being alarmist that the numbers now standing at 110 infections could exponentially grow?
Thank you, Mark, for this. We said earlier, I'm a physician cardiologist. I'm in a group of doctors who are concerned about the health of the people in a forum called Doctors for Healthy Living, and that's the context in which I appear before you. Now, let me tell you, Mark, you do not have. We can get alarmed at a number of 100, but we have preceding information about what this pandemic is doing elsewhere. So that message is very pertinent, even if it is at one patient or two patients, is extremely pertinent because we have all the information we need to know that this is a situation that needs to be taken extremely seriously by the citizens of this country and, of course, of the world.
Daktari, Yes, sorry to interrupt, but he said, I'm just getting a quick reaction and then we can get in deeper later on, but he said Kenyans should not wait for a death to get closer to them, to hear that someone close to them, perhaps a neighbor or relative or friend has died, for them to take it seriously. Do you feel that in a country right now, people are taking the measures, that is, as seriously as they should?
Now, for sure, from our observations as doctors, and Doctors for Healthy Living, there's a big gap between the big effort made by the government, from the very top and the minister, the whole government, to give all the information. The government has given a lot of information, but when you look at the practice in the grassroots, the practice by the citizens themselves, we see a big disconnect. We see a gap. So he's absolutely correct, because we need to bridge that gap, because citizens need to own this by understanding, not necessarily panicking, but by understanding that this is an existential threat, is a threat to all to the lives and the livelihoods and the way of lives of the country. So the citizens really need to understand that, because when we look clearly, and I think that has been alluded, when we look, we can see that this is not happening.
Right. All right, Daktari, just stand by with us. We'll be getting back to you on that and other issues that were addressed in the latest update by the government on the pandemic, especially here in Kenya. Let's just get a sense of what others are doing in terms of the county governments are doing in preparation to face this coronavirus and even some of the challenges that they're facing. Martin Maura joins us from Murang'a, where definitely the curfew has been effected, but there are some things happening in the dark that are leaving residents unsettled. Martin?
Yes, good morning, Mark from County 021. As you have rightly said, yes, some residents here are actually living in fear. More so, let me say the business people here in Murang'a County, they are living in fear. This is because, as you have said, yes, the curfew is being implemented, and the residents from Murang'a are actually towing the line because, according to the county commissioner, as we spoke 2 days ago, he said that 99% of Murang'a residents have adhered to the curfew and they are actually home by 7. Now the problem that is actually arising and the businessmen are complaining about is yesterday I can categorically say that some shops were broken into. Actually, they attempted to break into 4 shops, but they were unable, but managed to get into one, which had not been reinforced with steel. They managed to steal some airtimes, they managed to steal cigarettes and some money. And the other 4 shops, they were unable to. We have spoken to some of the residents, and they are saying that they suspect this is a ploy between, or it's a police working in cahoot with people. They're not saying all the police, but they are saying it's a group of policemen who are working in cahoot, or the policemen themselves who are breaking into the shops, because they are wondering, it is 7, the curfew is on course, everybody is at home. So they are failing to understand who could have the guts to go around breaking into shops in Murang'a town. Most of these shops are along the town, near the main roads. So they fail to understand. So they are saying it's either the police themselves or somebody working with the police getting protection so that they can be able to break into those shops. Now the police have spoken to the police. Yes, they have received the complaints and they're investigating the matter to get to the bottom of it, to know who is going behind the breaking in and the stealing of shops. The shopkeepers themselves, yesterday, they had very difficult activities. As some of them, we could see them installing metal grills. Others were changing the doors. They were putting the metal doors so as to try and maybe reinforce the security. So they are saying they're asking the police bosses to ensure that this does not happen again, because the business is low, and yet they are suffering from the theft and break-ins from during the curfew hours. So, Mark, as you have said, yes, Murang'a County was one of the counties that were yesterday, the previous day, the CS in charge of health, Mr. Mutahi Kagwe, said there was a victim from Murang'a. We managed to speak to the county director in charge of health and said, yes, Murang'a, one of the patients who is said to have come from Murang'a, but who was quarantined in Nairobi, but his home county is in Murang'a. She tried Dr. Winnie Kanye, who is the director of health here in the county, assured residents that yes, the person who was said to be positive of coronavirus had not stepped into the county, but she's asking the residents to continue following down the requirements and the guidelines that have been given out by the government to ensure that this disease is not reported here in Murang'a. Although she said that the county is well prepared just in case of any eventualities. Now, something else that you have said, the county is here, fumigation is ongoing. Yesterday they were here in Murang'a town, where they managed to fumigate the streets and the prison and the police stations and the markets. Today the team is heading to Mathioya sub-county, where they will also do the same in conjunction with Kakuzi Public Limited Company. Those are some of the few things that we are following up from this county, and we'll bring them in a subsequent bulletin later during the day. Back to you, Mark.
Before I let you go, and if you can hear me, the governor, Mwangi wa Iria, was one of the first to announce that they will stop or prevent people coming into Murang'a. That is, those shuttles that ferry people into Murang'a, in and out of Murang'a. How has that been effected, and has it been full in force?
Yes, Mark, something that that is something that the government has always insisted, calling it isolation of the inter-county isolation. He has said that not once, not twice, that this disease, as we all know, that it is being ferried by people. The disease is not ferrying itself. So what he has done himself, some of the matatu terminals, like the one from Muranga to Sagana, actually it has been closed. And some array of measures to matatu terminals during inspections, impromptu inspections have been going on. And anybody or any circle that has been found to be flouting those regulations, they're asked to withdraw from the terminus. Something else that they are doing is, it's only one matatu circle that is allowed, one matatu per circle that is allowed in the terminus. You know, yes, there is freedom of movement, and the governor cannot curtail that. But he's asking for people, the matatu owners, the circles, to be very vigilant, saying that yes, the curfew will come, maybe. The lockdown might come if they don't take care, and this is because the matatus themselves are the ones that are ferrying people. It has also reduced. It has also, to some extent, reduced the number of passengers traveling from Nairobi to Muranga. Considering that he is also encouraging people to stay at home. Mark.
That was reiterated by the CS Mutai yesterday, and something that is a message that is going to other counties. Thank you, Martin Maura in Muranga. Let's cross over to Taita Taveta County, where Bill Otieno is standing by in Voi. And along the same lines, Bill Otieno, how is the measure of avoiding people or preventing people from moving into Taita Taveta from other urban centers, how is that being effected?
Well, a very warm morning to you, Mark Masai, and I am indeed at Voi town here. And well, it's true that there are some measures that the county government of Taita Taveta have indeed put in place. Yesterday we did have a closed door meeting. We saw there was a closed door meeting between the county governor of this area, that is Granton Samboja, and the county commissioner, that is Rhoda Onyancha, and they did have a closed door meeting that had resulted to a decision whereby any passenger or any commuter that will be crossing Taita Taveta will have to stop by and be screened. That means that they have to come down from the vehicle that they are using, and as well being checked on their temperatures before being sanitized and given some face mask and some gloves. It is an exercise that has been set in place by the governor, and we are having two stops, or two check stops, and that is in a place called Ndii. This is on your way from Nairobi to Mombasa, and then as you come, those who will be coming from Mombasa, there's a place some 1 kilometer from here. It's a junction that they've set also another check or stop check, and these checks are being manned by Kenya police from this area. The governor is saying he's also trying to put the same measures around Loitoktok. Those people are coming from Loitoktok via Rombo and the last it to Taita Taveta. They'll have to stop as well and follow the same measures. We are also bordering the Tanzanian. We are also bordering Tanzania from Taveta part of this country, and here says the same measures will also be taken there for the people who are coming from Tanzania into the country, into the county as well. This is something that has brought some reaction from the residents, and indeed it is a coincidence. I don't know if I said it's a coincidence or it really matched with what Mutai Kagwe yesterday said, that is not expecting or is discouraging travelers who are coming from the urban areas to rural areas. And Taita Taveta, those who are traveling from Nairobi to Mombasa, they have to cross through Taita Taveta. Those who are traveling from Mombasa to Nairobi, they as well have to cross through Taita Taveta. There's a really big need of putting such a stop here, such a check unit as well here, so that to make sure those who have come from those urban areas, from the both cities, have to be checked so that they don't spread the COVID-19. But I'll also say the county is still going on well. Yesterday we had curfew going on while there's no eventualities that came up. And what I'm seeing now is, if my cameraman can pan, we are seeing there are some women, these are market women who have decided to put their products there and their foodstuff there. This is following a ban of using the market, open market here in Voi. They've decided to put their market there, and I'm thinking there's still no 1 meter social distance. There's still no 1 meter social distance, if you can look. And it's something that one has to be concerned about. Mark, that's what I'm having for you right now. But about the traveling ban, the traveling precautions given by the CS Mutahi Kagwe, I'll have to give you more details later in our NTV Sasa show and NTV at 1. Back to you, Mark.
Taita Taveta, thank you for that update. And yes, going into the weekend, there is expected to be a lot of travels, as is usual normally, but we'll have to see whether the strong urge from the government is being followed by Kenyans. And not too far from there, let's go to Mombasa County, County 001. Kevin Mutai is joining us. That's a hotspot, the coastal region generally, but yes, Mombasa County being from its position is a hotspot in terms of the cases so far. What's the county government doing, and as well as follow-up on the Kilifi Deputy Governor?
Well, good morning and good to hear from you, Mark Masai. Indeed, we're joining the broadcast from County 001, and a lot is being done by the county government of Mombasa and the health authorities from the national government to combat the spread of the deadly coronavirus. But of course, also, as you mentioned, there are concerns about the Kilifi Deputy Governor, with the CS Mutahi Kagwe yesterday reiterating that the Deputy Governor has recovered after the health officials conducted 3 tests which turned out to be negative, but of course also maintained that the law will catch up with him, and the reason is because he refused to go into mandatory self-quarantine for 14 days as stipulated by the government in the efforts to stop the spread of the virus. But the coast region indeed has been marked as a hotspot, and Mombasa coming second after Nairobi with a number of infected persons, followed by Kilifi and Kwale. 3 counties in the region so far have not reported any positive cases for COVID-19, but of course also here in Mombasa, 1 person succumbed to the coronavirus and was buried yesterday at here in Mombasa, but of course under the strict guidelines of health authorities, and a lot is still being done by public health officials here in Mombasa. We are informed by the county government officials that they are in the process of hiring more health workers to help in the current human resource available to help those patients under quarantine, as well as of course also the 6 people whom we are informed currently being quarantined and positive at the Makadara Hospital, that is the CPGH. We also understand that there are 3 other facilities that have been set aside and fully equipped for patients, positive patients, confirmed patients for COVID-19, and those hospitals are in Shika, Adabu, and of course the other one is in Mwakirunge. But of course also we've had the appeal from the county government towards private hospitals to also be ready in case of any case to be able to handle any case. But of course again, Mark, it is worth noting that the person, or rather the patient who died for COVID-19 was a patient who is said to have allegedly visited a private hospital but got turned away. But this is a matter under investigations, and we've had the Governor Hassan Joho yesterday, saying that they'll be calling upon the national government, they'll be calling upon the Directorate of Public Prosecutions to finalize on this particular matter and prosecute any person found culpable. Even indeed, that patient got into hospital but got turned away for the reasons not made public. But of course, also the county government has also received ventilators from donors, and this particular equipment will be taken to different health facilities here in the region to help COVID-19 patients. But of course, also something that is also not worth noting is that the county commissioner here in Mombasa has also reiterated that there will be no more sale of mitumba in our markets. The Kongowea open market is a place also that the authorities are taking or rather enforcing measures to ensure that this particular virus do not find itself there. Wholesalers, traders have also been taken to satellite markets in different parts within the county. There's one in Likoni, there's also another one at Tononoka grounds, and of course also noting that the county government has even proposed waiving some of the extra charges for traders from those particular markets, so that they can be able to comply with the guidelines set aside to ensure that they'll be able to fight this coronavirus. But of course, Mark, there's a lot that is still happening within the entire coast region. We are still following up with information from the health officials. Remember, the tracing of more contacts, of more people who had who came into contact with positive cases from this region is still going on, and these details we expect to get them from health officials. But of course, also we are closely monitoring from the health authorities, with CS Kagwe again expected to announce, or rather make a public announcement on what the health the health department, that is the health ministry, doing, and of course expecting to hear if at all there'll be more confirmed cases for COVID-19. And as I said earlier, this region, Mombasa, Kilifi and Kwale, are still the hotspot, marked as hotspots for COVID-19, but we are on standby. We have stretched our resources across all the region so that we can be able to have what you need to know from this region, and you will be informed. Stay tuned to NTV. We have everything ready for you. Of course, we'll be also speaking to business persons, the matatu drivers, businessmen who are currently saying that the business is done, but of course also they are fully complying with the regulations set by the government. The tuk-tuks drivers have also been advised to wear masks, but of course that is where we are currently saying there's a little bit of laxity when it comes to enforcing some of these guidelines, and of course the number of passengers that they are allowed to carry. But of course, Mark, with all those just a few reports from the coast region, we are on standby for more information in our subsequent bulletins. Make sure that you stay tuned for more updates here on NTV during our subsequent bulletins. Back to you, Mark Masai.
You got that right. Definitely hoping the viewer will stay tuned. Kevin Mutai from County 001, thank you for that update, and we, as well as our team that is down there keeping us posted on that. Let's cross over to Migori County. Bernardo Joang joins us from Awendo town, and yes, as you can see, he's very well geared up. Bernard, what are the measures there, especially with the market business and the situation in terms of protecting the residents in Migori?
Well, Mark, just as you said, it is when it comes to ensuring that all markets are closed. Currently, it is a market day here in Awendo town, and following the measures that was the directive that was given by Migori County Governor Zachary Kotobado, that all markets in Migori County should remain closed. As we speak right now, all markets in Migori County has been closed, and also in Awendo town. What's happening? Police officers are currently patrolling to ensure that no trader is allowed to step foot in Awendo town or any market here. And last week we saw in Rongo town where traders were chased away in Rongo town, and they resorted to selling their products in the bushes, and the police officer also managed to chase them away and arrest some. And this is also happening here. Police officers are moving around and also ensuring that those bushes, especially sugarcane plantation, these people might resort to selling their products are also checked. And currently there are some of the leaders who are also moving around Awendo town to ensure that no person or no trader is allowed in town, and also to ensure, telling people, at least to ensure their safety, to keep distance, the 1 meter rule. And also, without wasting away, I'll be speaking to one of the leaders who have been moving around. Why are they moving around? Why are they helping the police, at least to ensure they keep, they ensure that people are moving out of town, the traders are not in town. Join me. You are here in Awendo town. Join me here. You are in Awendo town and you are moving around. You started in the morning. Why have you joined the police officer in the fight?
Thank you so much. As a leader who was elected in Awendo, Awendo being a very busy town and a very busy market, we had to make sure that we also move around with the help of our police officers to make sure that our traders are not allowed to do business on a day like this, because we have to keep this disease at bay.
What are you telling them? What are you telling traders? Because you are talking to traders, shopkeepers.
We've tried to talk to the shopkeepers, and we are telling them if they have to sell their wares, then the 1 meter rule has to apply, so that we don't let the disease to get into us. Yeah, as leaders, we have to do that.
Apart from the towns in Awendo town, the main towns, we have markets in rural areas, the Mashinani. What are you doing? Are you also moving around in Mashinani? At least talk to these people, at least to ensure their safety.
We've decided as leaders that we have to go around all our market centers, all our trading centers, to enlighten our people of the dangers that this disease is all about. Because if we don't talk to them, then they might think that it is the government that is frustrating them, while it is not the government mistreating them, but the government wants to make sure that its people, its citizens, are safe wherever they are. So I'm also appealing to my people that as Awendo residents, let's adhere to what the government has put in place, so that we put this disease as far as possible.
They were talking of lack of sanitizers and also water taps where they can wash their market, maybe in the town. Do you have some plans, maybe you as leaders from Migori County, to ensure each and every market has these water taps and also sanitizers?
Thank you so much. As Migori County government, there are plans that are being put in place to make sure that all our market centers, all our trading centers have hand wash machines and anything that can prevent us from contracting this disease. I want to say that our sanitizers is a big challenge, and we have to accept that, but the county government is doing all it can to make sure that we get sanitizers at our shopping centers and at our marketplaces.
Well, thank you very much. Thank you very much. Mark, I was speaking to some of the leaders who are now out to help the police officer in this fight. They have been moving around with police officers and also talking to people, sensitizing people, telling them to keep that distance, the 1 meter rule. And also remember, it is a market day. We will be here till the end, maybe up to the evening, where we'll be talking to some of these traders on why are they not adhering to the rule that, or the directive that was given by Migori County, that they should keep or they should not step foot in these markets. And remember, these are some of the people who are currently engaging the police in a running battle in town. And also we'll be talking to the police officer, the police who is in charge of that operation. I'll just talk to them, get what are the measures and how many people have they arrested so far, because we are made to understand they are not giving chances. They will arrest any trader who is going against the rule that was given. Back to you, Mark.
Bernardo Juang in Migori. And let's now go to the northeastern part of the country. Ahmed Maulid, our correspondent, is standing by. Ahmed, if you can hear me, the situation in terms of awareness about the coronavirus pandemic and reality in Kenya, has it hit home in Mandera?
Thank you, Masai. Yes, as you said, the coronavirus is real in other parts of the country, but here in Mandera, seemed to many, particularly the illiterate, that it look like unreal here. And here in Mandera, we have two opposing sides: the county government, who are not taking any chance when it comes to the fighting coronavirus, knowing that the consequences it had should it arrive here in Mandera County. Then there is on the other side, that is the president majority who are literate, saying that the coronavirus is not for Muslims. There is many myths the residents believes here in Mandera County. One of them is that they believe that coronavirus is not for Muslims, and they say it's meant for maybe other people of other beliefs. But on the other side, Mandera County government is not relenting, and is doing whatever it takes to control, to make sure that the coronavirus doesn't get any chance here in Mandera County. They have placed all public health officers, all entry point in the country from Fafla and Kutulo, that is the main entry point, to here, to the far end Mandera town, which borders Ethiopia and Somalia. Then they have taken several measures such as building new isolation centers that will help treat the COVID patient should it arrive in here. They have opened several high class isolation centers across the 6 sub-counties, that is from Mandera East, Ramu, and Takaba, Banisa, and Elwak and Kutulo. They are saying they are not taking chance. But then the hardest task is convincing the people that corona is real, and they're doing whatever it takes, preaching from all media stations, from social media, telling people that the corona is real. People should take all the precautionary measures. For example, they have banned the business and the consumption of cat in Mandera County, but the business community, that is the Mira traders, are taking up arms with the county government, saying that is their livelihood, and instead the government should provide. And the government have a limited resources, but they know the consequences it had, and they are taking no chance. Allow me to invite 1 or 2 residents here to say what they believe about the corona, knowing that the county government is facing a lot of task when it comes to convincing the resident that corona is real, and people should take care. Yes. What do you believe? We know that the county is struggling when it comes to convincing the residents that corona is real. But what do you believe? I believe corona exists. There's no scientific discovery compared to the symptoms in the past. Therefore, the system rising enough is not all I can say is that.
Unfortunately, we had to interrupt that link there by Ahmed Maulid in Mandera, with the audio not being too good. But from what we've heard from his update is that the leadership is, of course, grappling with the issue of creating awareness and actually making the residents in Mandera realize that coronavirus is real, it is here, and it can get even close to home as possible. And just let's bring back Dr. Robert Madenge, and I believe you were listening in as the correspondents were giving us just a feel of what their counties are doing in terms of response and some of the challenges that they're facing. Are you surprised? I don't know if you were able to listen in, that in Mandera there are areas and there is the notion that coronavirus isn't quite something they ought to be worried about.
No, thank you, Mark. The connection is sometimes as good as it could be, but I'm clearly getting you most of the time. Now, what I would like to say is that I'm not really surprised. Pandemics, have occurred throughout history, and there are always those people who are vulnerable to pandemics. For instance, we know that pandemics, whenever they came, they would take tens to hundreds of millions of people, but they only take people who are vulnerable in a certain way. In fact, if you look even at the Bible itself, the Bible gives instructions about physical distancing very, very well. I believe I can quote that, Isaiah 26:20, which says, "Go, my people, enter your rooms and shut the doors till this is over." So in other words, physical distancing is something that is ordained by God. Now, what are those vulnerabilities that make you vulnerable when it comes? What makes it possible for it to sweep you and leave somebody else? What makes that possible are certain things. Number one is lack of using the wisdom of the day. For instance, today we know the science, we know the wisdom of the day. We know that if what you need to do to get it. The other thing is, of course, people who do not change their behaviors, who do not believe, people who do not who are cynicism. So in other words, epidemics take tens and also disable lots and lots of people, change the ways of lives, but only in certain ways. So what should be done? People need to realize that we are living at this time, unfortunately, a pandemic life.
Yes.
Our generation has been faced with a pandemic life.
And
therefore, to survive the pandemic, and it's the whole world, there are certain things we need to do in order to survive. And those things are clear today. The science is there. It's a question of now the citizens who really would like to, at the end of this, to be around and to be untouched, to do the right thing. And the right thing is, of course, is not to get infected at this time, is to avoid infection. That's the only answer. But I really appreciate, if you can allow me to comment, I can see a lot of efforts by the county governments, from the national government, by the county government. There's a lot of effort at that level. But now, now we need to go down to the lay leaders, the youth leaders, the religious leaders who should preach this word about physical distancing. We need to go to that level, because that's what I see that is missing. We need to go to the people who normally act as politicians, but this time acting on on health messaging, not political messaging, but health messaging down at the grassroots.
Dr.
We
Madenge,
need to activate grassroots leadership in the elders, in the Nyumba Kumi, in the sub-chiefs and the chiefs, to deliver that message to those people who still don't believe it. Because
very crucial.
It is our fault if we have not communicated enough. We have not warned people enough that this is serious. This is serious.
And it is
strategy.
Apologies for just interrupting, and I'm totally agreeing with that point. It's just to get onto something a bit more specific to the Mwananchi, as you say that this needs to get to the ground, to the county level. There's one of the issues there, the markets, where many Kenyans, hundreds, thousands of Kenyans visit the markets. And there is a reality of coronavirus, but there's a reality of making a living on a day-to-day basis. How would you advise those who have to visit a market to get food and even have to engage in that trade?
Now, let me go back a little. If you allow me, let me go back a little bit and say, look at what has happened, let's say, in China, in Spain, and anywhere else.
Yeah.
The people that our situation could be slightly different from the situation in, for instance, we have a very young population. We have a population, in fact, whose median age is about 19 years, compared to America, where the median age is 43 years. So nobody knows how this pandemic will hit sub-Saharan Africa, where the population dynamics are completely different. We have other things in this situation that are completely different. For instance, we have other infections. We have a population that has other infections, like, for instance, things like malaria, even including HIV in sub-Saharan Africa, nutritional issues. We do not know how this will hit us. When you look at that, we are waiting as the health professionals and scientists to see how will this hit us. Because, for instance, we are in the West and in China, it is an old people's disease. But we don't know what, clearly we cannot tell for sure what it will be here, because our young people may be vulnerable in terms of the fact that we have this double burden of disease, of infections, which also compromise immunity, and also, of course, other diseases. Now, when you look at those dynamics, I think we have to be extremely careful how we deal with it. What is the best strategy? The best strategy is what we are doing, and that is containment. It's the one that is affordable. We cannot afford the next level, which is a mitigation, which is dealing with the people when they are already sick. We can't afford that. No system in the world has been able to afford that. We don't have enough, critical care beds. We don't have enough health infrastructure to support this. So our best bet is to go full scale into containment, which is physical distancing. And by the way, I heard a lot about 1 meter. The accepted physical distancing now is 6 feet, which is about 2 meters.
Yes.
But nobody can be blamed for that, because when we started, we were talking about 1 meter, now we talk about 6 feet. And when, of course, that's the key. It is affordable, it is practical, and through mobilization, full mobilization, it is possible to actually avert the epidemic and make it just a smoldering disease like any other disease.
Daktari, if I
yes.
may interject at this point, you're talking about the full-scale measures that need to be taken, and you do borrow from other countries that have faced this coronavirus, China, Italy, and some of the measures that they have put in place is issues like a lockdown. Is that something that we could actually afford given our reality as an economy?
Now, let me tell you, Mark, at the level at which our epidemic is, at the level at which it is very possible to institute very aggressive containment and preventive measures and avoid a lockdown.
Yes.
Because it is still early on. Okay, given we have now 100 cases and we don't know how many people are symptomatic out there. But if, for instance, you are able to capture the majority of the affected people through data collection, you know who has come through the airports over the last 2 months. There's nobody, follow these people aggressively. And this is happening, by the way. I'm not saying it's not happening.
Yes.
Because like the FCA said yesterday, we would be elsewhere if this has not been happening. But it can even be taken further data collection, chase those people, look for these people, look for their contacts, contain them both, in fact, mostly activate the grassroots oversight systems like Nyumba Kumi and elders and sub-chiefs, and contain these people in home settings. If you are able to do that, you are going to reduce the pandemic to a situation whereby it is like any other disease. You see, what everybody is talking about, flattening the curve, is about capturing all these people, stopping the exponential growth of the pandemic, and therefore being able to have the system able to cope. Because I can give you an example, Mark. We, as a cardiologist, we know that every week there may be about 100 heart attacks that occur in the country. 10% of those go to ICUs. But what happens if you get 2,000 heart attacks in a week? There will be no capacity to do that. So we can reduce the pandemic by containment through data collection, very targeted and aggressive testing to identify those affected and those at risk, extending the ways of confining them and monitoring through the systems that are there. If that is done aggressively, you can actually have life go on quite normally in terms of like what we are doing now. We have a curfew, but during the day people can work and therefore be able to avoid a lockdown. I don't think it's too late yet.
But life is
to institute those kind of measures.
But it has been repeated over and over again that these are extraordinary times and they call for extraordinary measures. And yesterday, CS Mutai urged strongly that people stay put and desist from moving up country where they might feel safer. Just re-emphasize and reiterate that message, because it for many would seem it is safer to be up country, because I'm not even working at the moment, because many companies have scaled down. Why not just go up country where I would be able to be secure, for instance, with the issue of food?
Yes, I hope I have heard you fully. But to reiterate that point, in terms of that, remember when we talked about containment.
Yes.
Contain disease where it is. And how do you contain it? First of all, we know how it came to us. It came from elsewhere. So even locked regionally, we will be able to take it to our vulnerable people out there that's very well expressed by the CAs. But let me put it this way. It extends even beyond visiting other regions. It extends to when you now stay in your house, because the other thing the government is saying is stay home unless you have to get out. It means you do not visit even within Nairobi, and you don't get visited. I can tell you, yesterday I had a 52-year-old gentleman who was telling me, who is very, very health conscious, one of my clients, and he told me he's done all he has done, because we've talked before, but he has the early 20s year-olds who are still going out. He is staying at home, but his 22-year-olds are going out occasionally. And of course, I was asking, where are they going? I thought everything, the social thing was closed. So I told him that what you are doing amounts to really nothing, because even if you stay in your house, but somebody goes out and comes back. So it means that even you are not visited and you don't visit. In fact, the idea during a pandemic is, unless you can't hide from the pandemic. And hiding means, and that means that therefore that when it is over, you'll be there. Now, for instance, in this particular case, remember we are suffering because we have no immunity, because we are dealing with a completely new bag. If you survive the pandemic, then you even know, when there is treatment and when there's a vaccine, when it is neutralized. But if you make some foolhardy decisions, like not listening to the guidelines of the government or the wisdom of the day, then the storm sweeps you. And remember, if many people do not follow, then it will cause problems for the whole society. So as an individual, do not make sure you do all you can not to get it. As a community, the same. And of course, for all of us, it is at this moment, let's help the government. Let's do the best we can to contain it, so as maybe not to get to a lockdown. But of course, if that is not possible, that could still come, because all measures have been done to prevent the catastrophe that can occur. If it is not done.
Yes, sorry to rush you. We have less than 3 minutes to wrap up, but you've spoken about there not being a cure at the moment, and many scientists are working towards getting a vaccine. But we've also heard of recoveries. Explain this to the Mwananchi, that someone recovers from this particular coronavirus. Does this mean that they cannot contract it again and they've built an immunity against it? How do we explain that?
There has been a few reports of people who recovered and then turned positive. But from what is known through the other viruses that similar infections, some immunity is conferred mostly. So all the data is not out, but there's no reason to believe today that people who get infected will not be immune. And immunity means two things. Either you don't get it, you are protected fully from not getting it. Or secondly, if you get it, it is just a mild disease. So we should have full faith that once you've gotten it and you have recovered, that you will have immunity confirmed. There's no reason not to believe that. And if you allow me, Mark, before you finish, I'd like to talk about the mask.
Just less than a minute.
Should be, I thought it was important we talk about.
Certainly. Go ahead.
Whenever you are not able to maintain the physical distance of 6 meters, which means you are in a border, tuk-tuk or whatever. If you are not able to maintain the physical distance of 6 meters, and it is not assured, and these are many circumstances, then you should wear a mask. I wanted to make that comment.
Can someone use, for instance, if it's not accessible to you, even a handkerchief, some rudimentary measures to protect yourself, to cover this particular general area, your mouth and your nose?
In total agreement with that, because we know that the major route is the droplets, and it works best when it stops the person who is infected from having that those droplets get out. So whether it is, but it is whatever you can use to stop. Although if it is a cloth mask, it's preferred if it is cotton. Okay, but anything that will hold the droplets will be helpful.
Dr. Madenge, I really appreciate your time. Thank you for joining us this morning. And you're just definitely one of those resourceful people we'll be reaching out to clarify the issues of the coronavirus pandemic that is facing us as Kenyans. Have yourself a good day, sir, and keep safe. And from that conversation, we'll be getting into NTV Sasa in a couple of hours, or just actually less than an hour, to get an update as well from different parts of the country. And as we get updates from the government during the course of the day, we will be bringing that live to you. And yes, I'll be back at 1 o'clock, unless there's definitely some breaking news. For now, stay safe, stay at home if you don't need to leave, and of course, take care of yourself and those around you. Have a good morning. I'm Mark Masai.